Hi, everyone. It's Dr. Pedersen, and I'm back with another episode of What the Floss. And I am so excited today because I have to introduce you to an RN that works with me at Hideaway Wellness and Aesthetics, and this is Katie Goff. Hi, Katie.
Hi. Thanks for having me.
Oh, I'm so glad you made it today. I've been waiting to talk to you about this stuff, and I just cannot wait. So let's start with a little bit of your background. So you are an RN, and how long have you been an RN?
I actually graduated nursing school during the pandemic, but I've been in medical care since 2007. I was a medic in the United States Air Force.
Wow. Thank you for your service.
Thank you. Yeah. And so basically just always knew that I would end up going to nursing school, and I just really can't keep myself from growing. So once I found out about the med spa, I just had to learn more.
And it's right in your backyard. You actually live in Peculiar, Missouri.
Yes.
So it's right in your backyard. Yeah. Well, like 2 minutes from your house, I think?
Exactly.
Yeah. Fantastic. So I wanted to talk to you specifically about the new implementation that we've had at the med spa for the last couple of months, and that's specifically the BioT products of hormone replacements. So everything from testosterone to progesterone to vitamins, nutraceuticals, all kinds of stuff. So that's what I wanted to invite you today to talk about. So we went to a BioT training a few months ago, and tell me kind of the highlights of what you learned about BioT as a company. Like, why did we choose to go with BioT versus all the other brands of hormone replacements that are out there?
Well, I think BioT's reputation and just their training in itself speaks volumes. I mean, they have everything lined out from, the smallest bit of vitamins to, couples therapy almost. It turns into that because they're able to help every single person. And basically, I sat through the BioT training in Denver, and I was almost in tears myself. There were a few times where I caught myself like, wow, I can't believe that, we rely so much on traditional medicine that just isn't fixing certain things. And, learning more about some functional medicine providers who have been, just getting these people's lives back on track, making them feel whole and human again, and being able to get the most out of their life.
Yeah. So you mentioned traditional medicine, right?
Sure.
So traditional medicine, you go into your doctor once a year, you get your wellness check, you get your blood drawn, you get a list of medications that you're supposed to take. So when you get your blood drawn, is it the same as when you come into Hideaway and get your blood drawn? Are we looking for the same things?
They are looking for some of the same things. They'll check your thyroid. They'll check your cholesterol. They'll make sure that your blood can clot properly. They'll make sure that kidneys are functioning, liver is functioning. But what they don't check is the specifics regarding estrogen, testosterone. For some men, it is okay to get testosterone checked through your PCP, just because everyone thinks that only men have testosterone, but women do too.
Great point.
Yeah. And they also don't typically check the estrogen levels in men because they think that women are the only ones with estrogen or need estrogen. Yeah. So we all share the same type of hormones at different levels to optimize our health. But with what we can do at Hideaway is get specifics. We plug in every single number, every single thing from your height, weight, blood pressure, your hematocrit, all of your vitamin deficiencies, everything like that, and can get a specific idea on how much hormone replacement therapy you might need. At your primary care clinic, they're really not going to be able to dive that deep. They don't train in this in traditional medicine. They have to specialize this and go into a more functional medicine route in order to gain these specific, education for this specific thing.
Yeah, that's a great point. So I remember, I'm faithful about going to my PCP every year,
Me too.
getting that blood drawn, and then I get the list back in my app that says everything's within normal, within this range. And it says, your age range and your gender. And if you fall within that scope, you're fine. Everything's green and everything's good. If you're a little bit outside of the range, they say, oh, let's wait 6 months and let's test it again. So what do you know about that range that's kind of generalized for your age and for your gender?
Well, I actually saw my primary care right before I got pelleted myself and completed the labs at Hideaway too. Everything looked normal on paper because I'm a female and they're not concerned with my testosterone levels. My doctor did not check my ferritin levels, and I was severely anemic. And when you're anemic, that hinders your oxygen flow because you don't have enough oxygen within your red blood cells to provide your organs with the vital oxygen that they need to function, including your brain. You can't process things. You can't process your emotions properly. You can't process stressful situations, happy situations, things like that can also be chalked up to anxiety. So a lot of the labs that I got at my primary care before I did the in-depth labs at Hideaway showed that everything was normal, that I was fine. And in fact, my primary care, I love her. I won't see anyone else. And I asked for her permission to do the HRT so that I could not be fired as a patient because I wanted her trust. So that's definitely something that you can talk to your primary care about. But she offered me a synthetic hormone or a birth control and continue SSRIs and just roll with it, that this is just how it's supposed to be. And I will tell you, 3 weeks after getting pelleted, I'm a whole new woman.
That's incredible. I know I was there with you the day that you got pelleted because you pelleted me too.
Yes.
So I actually saw you that day and you were not sure if you wanted to go through with it. There was a lot of anxiety, a lot of fear saying, hey, is this the right move for me? Is this the right time for me? All those kind of things. So tell me more about what you were feeling that day.
So I have struggled with health anxiety after losing my husband to cancer in 2021. It was very unexpected, it felt abrupt. It was the longest 14 months. It was such an insane battle. And I, ever since then, have struggled with health anxiety. And it was not even close to being like a hypochondriac type situation. It was true. I have been in the ER in panic attacks because I was convinced that I had some sort of illness that was going to kill me. And introducing anything new to my body has been a very big struggle for me. But I rely on God and my faith to get me through that. Thankfully, Lindsay was able to pray over me and the whole room before I got pelleted. And I was just standing in my kitchen today. I was just like, thank you, God. Like, I feel so good. Like, and it's just one small little teeny tiny pellet and it fixed everything. And I think my biggest hesitation was what's next. And we actually have, the handout that says, okay, you got pelleted. What's next?
What's next?
And it's living and breathing and functioning and not being crippled by, hormone deficiencies or vitamin deficiencies.
Wow. I don't want to gloss over that because that is incredibly powerful.
No.
That's incredibly powerful. So tell me what you've noticed. What have been the biggest differences in the last 3 weeks of having that pellet in there?
So for one, energy. And for two, being able to process thoughts. I'm able to actually complete tasks and not be so forgetful. And then also the sleep is amazing.
See, and that's what I feel too. I feel like the sleep is fantastic.
Actually feel rested.
Yes.
And able to wake up and I'm not groggy. I'm not hitting snooze. My recovery time, the other day I was on the elliptical. It was the first time I could work out after the pelleting. And I was on the elliptical and normally around 12 minutes, I'm like, okay, I'm ready to get off of this thing. And I looked down and it was 27 minutes. I had already put in 2 miles and I was like, I could keep going for another half hour. This is incredible. And lifting weights, I don't feel weak. I'm able to actually push myself in the gym. And then just kind of being able to regulate emotions a little better.
That is fantastic. And the lifting weights part is so important for a female, right?
Absolutely.
Especially when you get into your decade of life and then my decade of life.
Sure.
So yeah, very important for our overall health, our body position. We were just talking about posture and bone health as we get older as well. So were you experiencing any perimenopausal symptoms at all?
Absolutely.
You were. Tell me about that.
So basically a shift in menstrual cycles. Most of the time, it could be chalked up to PMDD.
PMDD, yes.
PMDD.
Yeah.
There's so many acronyms. I can't keep them all together.
Just make up some letters.
Right? Yeah. But yes, most all of my symptoms could be chalked up to PMDD. And, nothing that I've actually been diagnosed with, but just severe PMS symptoms. Again, with the mood regulation and also just the overall body aches and cramps. This will, be my first cycle since starting. So we'll see how it goes. But so far, I have not had the shift in moods. Normally, once I'm in my luteal phase, I crash. And all I want is sweets. And I just crave food, and then wake up feeling guilty about how I treated my body the day before, and then fall even farther. So I have not experienced that this month. I have not experienced a harsh crash during my luteal phase, and thus making the emotional roller coaster much less adventurous.
Yep. And it's so interesting that you say that, because if I can overshare for just a moment, I already had my cycle since we had the pelleting for me, and it was the easiest one ever. It actually made it the right length again, everything was right. And you're right, I didn't crave sweets before. Normally for 2 days before, I'm like, where's all the chocolate? Give me all the chocolate. And there was none of that. So yeah, very manageable. And I still get like the emotion, and I wonder where it's coming from, like the first day and the last day or whatever, when you see a commercial on TV, and brings a tear to your eye.
Yeah.
But other than that was it. And again, very mild and manageable. I didn't feel like it affected me.
Yeah.
And it didn't affect my daily activities and performances. Yes.
Yeah. Normally this would not be the week where I even felt like going to the gym. And yesterday I just stopped myself in the middle of cleaning the house, and I was like, I'm going to the gym. Like, I'm just going to go. Yeah. It wasn't even in my plan. Like, I didn't have to coordinate anything. I was like, no, I'm just going to run to the gym, and then I'll come back home and pick up where I left off.
That's amazing. So you had enough energy to clean the house, go to the gym, and come back and keep cleaning the house.
Like almost 2 hours at the pool with my kids.
Wow. And a happy mom at the pool with your kids.
Yeah. I didn't have to yell at anybody. Nobody drove me crazy. But that is one thing for sure, is my emotions. I have not been, when I say emotional, like teary-eyed. It's almost like a depressive phase. When I hit my luteal phase, is really just hits me hard, and everything is very upsetting. And it wasn't.
That's incredible.
Yeah.
So I read a lot of the BioT material, and I think for me, we chose to go with BioT because the company has so much research backing them. And my understanding is there's two really incredible companies that are right neck and neck, and they share a lot of the leadership. One started one company and left to start another company. So they're very similar in what they do for the bioidentical hormones. So that's why we chose to go with BioT, because it's the best brand available, and we only want to offer the best, right? Yes. So tell me about the anti-inflammatory property, because I think that's important in men and women. So plugging back your testosterone to optimize levels of where it was around your 20s, your decade in your 20s. What's the benefit of that?
So a lot of times we are able to recover from things a lot faster in our 20s. You go, and most of the time people can relate it to like partying in college or something like that. Right. You can hang out until 2, 3 o'clock in the morning, and then wake up and go to your job at 8 o'clock, and then it's the same day.
Is that how you used to be, Katie?
No.
No, in all honesty, I was not like that. I partied in the chemistry lab, and that was it.
You're right. The chem lab.
But for real.
Right.
I was in the chem lab.
I'm sure. But yes, it does. It gives you that same younger type recovery, and adding in the nutraceuticals as well. It can help your body regenerate those cells and get you back faster.
Amazing. And you saw such a great result that you actually got your husband in there as well. Let me ask, how old is your husband?
He's 46.
Okay. And I've actually known Rich for a few years now. Yeah. So I see him on the dental side of things. That's a violation of HIPAA. Sorry about that.
Hey, I'm pretty sure we have Google reviews out there for you. So
it's public.
It's already out there.
Well, we've laughed every time that Rich comes into the dental office, because he falls asleep almost immediately. We lay him back, or even if he's sitting up and we're he's just quiet for 2 minutes,
he's out.
He instantly falls asleep.
Out.
So you said you need to get tested. You need to get this started on this. So tell me, on the male side, what have you seen firsthand for your own husband?
Well, I would say it was probably, he was ready to get back in the gym. He does CrossFit. He was ready to get back in the gym as soon as he could. So at that 5-day mark, he was just like, can I please? It's like, okay, like it's all fine. I checked out his incision and everything was fine. So, but I will say that was his first immediate, just noticing how quickly his pulse could recover from cardio. And then being able to lift after, a really intense cardio session in the CrossFit gym. Then also he rides dirt bikes.
Right.
And being able to get on the bike, run through a moto, and then, not be as affected as he was. He also has asthma. And I am praying and hoping that it can minimize his albuterol need because his body will, be full of the nutrients and things, the energy levels, that he won't feel that tightness in his chest or, that lack of oxygen. But he's also being able to not have to put on a hoodie to walk around the house. He doesn't feel cold.
So
his cold sensitivity. He noticed that almost immediately. I want to say it was like the second night after I pelleted him, he was able to sleep without a shirt on. Wow. Normally he is like freezing in the middle of the night and didn't wake up.
Yeah.
He wakes up really early every morning to go to work. Yeah. So we have 3 kids. They're all busy. We don't really have an option other than to go to bed later than we probably should. But it's just kind of one of those things he's accepted, but now he's actually getting the quality sleep that he needs to be able to make that 5, 6, 7 hour night of sleep work for him.
Wow. That is really great.
Yeah.
So I usually hear women talk about feeling cold all the time, carrying a jacket or a wrap when they go into a restaurant, but I don't really hear men talk about that.
Nope.
That makes me think we're supposed to sleep between 65 and 67 degrees, right? We're supposed to be able to sleep cold and tolerate it without having the hoodie on, without having tons of blankets on. Yeah. Yeah, that's incredible. I cannot wait to hear when he hits like his peaks.
I know.
What's going to happen.
See how... Yeah.
Yeah. Now, you've mentioned a couple of times that for you had to wait after your pelleting to work out a certain number of days. And for Rich, he waited about 5 days to work out and you checked the incision. So tell me kind of the process. What if somebody's never gone in for hormone pelleting before, what's the overall process? Is it a surgery? Is it something that they have to be super careful of? Can they resume activities in what amount of time? Like, what's the risk involved with pelleting?
I gotcha. Well, first off, we start off by going kind of over what BioT looks at as far as the lab work that we need. We'll bring you in, draw some labs, and then once we get those results back, you can come in for your consult with our nurse practitioner, Jennifer. And then on that day, we typically offer the option to pellet. So what that looks like is you will lay on your side. Depends. We try to swap sides, but it is placed in the subcutaneous tissue on your glute. But we try to keep it up high enough to where you don't actually sit where the pellets are injected.
So technically, for those of you that aren't nurses, what that means is it goes just under your skin in your butt cheek.
Yeah.
Okay.
Do you want me to re-say that?
No.
Okay. But yes, so like the fatty tissue is where they're actually placed. And basically, we will numb the area. There should be absolutely no pain when we actually insert the pellets. For women, you're typically only going to have 1, maybe 2 pellets placed. Sometimes they need like additional estrogen or something like that, but it's teeny tiny. So there's really, it doesn't really make a difference for that. But it's a small incision. We do numb it first. So sometimes you can feel when we inject the lidocaine, it's just going into the tissue, the surrounding tissue area, so that wherever the pellets are being placed, there isn't any pain. A lot of times you can feel pressure just because we do kind of have to force it through the tissue sometimes, but no pain. And then there's no suturing involved.
No stitches?
No stitches.
Okay.
So we use steri strips to close the incision. Once we get the bleeding stopped, there's really minimal bleeding actually. It's just the small capillaries through the fatty tissue there. But we'll get the bleeding stopped and then close it up with steri strips. And then we have a gauze and Tegaderm, the clear film that's on there. That stays there for 3 to 5 days. I left mine on a little longer because I was I just didn't
test it out. Right? I did
just
the
to
same
see
thing.
how it was.
I did 4 days and I was like, it's probably okay.
Yeah. I'm pretty sure I did like 7 days, but it's fine.
And it stays on through your shower. You shower as normal and you just have this little piece of gauze that's clear.
Right there on your butt.
Almost looks like saran wrap, right?
Yes, it does. So, and then once, those come off, you just have to pay attention to the incision site just to make sure there's no additional signs of infection, redness, swelling, anything like that.
Have you looked at your incision site?
I have.
Yeah, I have too. It's tiny. It's like the head of a pencil eraser. It's tiny, tiny. Yeah.
I will say I was anemic when I had mine placed, which hopefully I'm, on the mend from that. So I did have a little bruising. But that is pretty common for someone with low iron. So if that's something that we're trying to correct, you may have some bruising the first couple of times. But like Rich, he did not have any bruising whatsoever, no swelling, any pain, nothing. But basically, we do recommend avoiding the exercise for a week after because it increases the risk of extrusion, which is when one of the pellets come out of the incision. It's very uncommon, but whenever you work that area, doing squats, elliptical, riding a bike, lunges, anything like that, it can kind of push that muscle, inflame the muscle. Obviously, that's what we do when we work out, is to grow those muscles, and it could potentially push a pellet out if that incision's not closed.
And I think BioT stats say that it's less than a 1% chance of an extrusion of a pellet. It's pretty minimal. And so what I did was I worked out my lower body the morning of my pelleting. So I did that. So it was already like feeling the gym soreness, right? So I couldn't really tell the difference between that and anything else. But then I just worked out my upper body for the next 3 days, 5 days, and it was fine. And then by the time it was time to do lower body again, had been a week.
Good.
So yeah.
Awesome. I had all the intentions to do that, but COVID decided to come anyways. But I will say, I think I was able to recover from COVID a lot faster because of all of the supplements, all of the nutraceuticals that I was able to keep on board immediately.
Yeah. I've switched to those too. Are you doing the NutriPacks?
Yes, the NutriPack and the Iron Plus.
Yes, me too.
Oh yeah. Are you taking yours twice a day?
Yes.
Okay.
Yes. And mine actually has the vitamin C built into it, right? So better absorption.
Iron Plus. Yeah.
So that's all. I mean, again, another reason why we go with BioT everything when it comes to that. So yeah.
And keeping the nutraceuticals at, buyer-friendly cost. We want our patients to be able to take these on a regular basis because it can enhance their experience with the hormone optimization and really give them the full benefit. Yeah.
So on my nightstand, I used to have 7 bottles of vitamins and supplements to take every single night. And it was like almost like a meal replacement. My tummy was full by the time I took all of these pills and they get stuck in my throat. Now I just do that little NutriPack and it's already has the methylated vitamins, right? So methylation of the vitamins makes it more absorbable because a lot of the population does not have the ability for their body to methylate those vitamins, make it into a usable form. So BioT again gives us the NutriPacks, convenient, but also methylated, right?
Absolutely.
Yeah. I'm super excited. This is going to be so good.
I know.
We're going to have to reconvene after we do like our peaks and then when we go round 2 and let's see how your body goes up and down and mine too. So I'm excited for 3 to 4 months of feeling great.
I know. I'm looking forward to it.
Thank you so much for joining me today, Katie. I so appreciate it. And thank you everyone for listening. I'll see you next time.